I was doing a self-breast exam, noticed that I had a lump. When I did the exam, I was like, oh, it's just another cyst. They had me come in, let me know that, yes, indeed, there was a tumor and it was cancerous.
An ABC 27 special presentation.
I was 31. They said, I'm sorry to inform you that you do have breast cancer. It's shocking. It's not something anyone really expects to hear about themselves. I was scared. I was very scared.
Penn State Hershey Breast Center presents Hope and Courage, a tribute to breast health, brought to you by Penn State Milton S. Hershey Medical Center.
Good evening to you. I'm Alicia Richards. For more than 25 years, October has been known as Breast Cancer Awareness Month. No matter where you go, you see pink everywhere. Here are some statistics for you. Since the early 1990s, the breast cancer death rate has dropped more than 30% in the United States. 3/4 of women diagnosed have no family history and are not considered high risk. 1 in 6 breast cancers occur in women ages 40 to 49.
Thanks, Alicia. A young woman's life changed within a matter of seconds. She said her world stopped when she heard the words breast cancer. 34-year-old Katie Kiley mixes secret ingredients together to mark a special occasion.
We're going to make a hot milk sponge cake, and that's going to be in celebration of our 2nd wedding anniversary.
It's been 2 years since Katie and her husband Jake Gardner said, I do. A 2-year journey filled with many happy times and many sad times too.
We moved here on June 21st of 2010. At that time, I had felt a lump in my right breast, and it was painful.
The pain at the site of the lump persisted, so we said, well, best thing to do is to have this checked out.
I have a family history of breast cancer in both grandmothers, and so given that history, I thought even though I'm 31, it's really a good idea to schedule a mammogram to get checked out.
On the mammogram, it was very difficult to see the lesion because it was so far down on the lower part of her right breast. An ultrasound was performed, and we could clearly see the mass that Katie was feeling. It is this hypoechoic or dark lesion that had irregular borders to it. Very suspicious.
They called me back and they said, we'll need to schedule another appointment with you to do a biopsy, and then of course your heart drops to your stomach.
In my mind, I'm still thinking this is most likely going to be a benign lesion, something that we don't really need to worry about.
Katie wasn't so sure.
It's just the idea that I have something that needs to be biopsied is a very scary thing.
She did undergo a core biopsy, meaning that we took small slivers of tissue from the lesion.
They did call me back in and they said, we have the results, we'd like you to come in and we'd really like to speak with you. They said, I'm sorry to inform you that you do have cancer. When they say the word cancer, of course it hits you like a ton of bricks. And after that, I believe I heard cancer. Ba-ba, ba-ba, ba-ba. You just don't hear any words after that.
At that point, everything kind of stopped. And I know it all stopped for Katie, just trying to take in the diagnosis that you have cancer. I went outside and called my parents and called her parents and talked to them, and then kind of just fell apart myself for a little bit.
Doctors wanted to know why Katie had breast cancer at such a young age, so she underwent genetic testing.
They found out that I have it's called a BRCA1 gene mutation, and it basically is a hereditary gene mutation that was passed along by my father's mother through him and to me.
Katie's grandma Jessie carried the gene. She died from breast cancer at age 45 back in 1959.
Once we knew that she was a gene carrier, that put her at increased risk for developing a new primary breast cancer after we would treat this cancer that she had now.
I ended up making a difficult decision to have a bilateral mastectomy so that I wouldn't have to go through it again.
Before surgery, Katie needed chemotherapy. Before chemotherapy, Katie made some big decisions.
She wanted to do egg preservation. It's because sometimes when you have chemotherapy, that can decrease the likelihood of you being able to get pregnant.
I ended up being lucky enough to have them retrieve 21 eggs, of which 17 were viable and 12 fertilized.
Then Katie and Jake exchanged vows.
We started planning on a Sunday. We had everything tied up by Monday afternoon, and we got married the Wednesday before I started chemo, and that was September 15th, 2010. I just focused on the fact that I was finally married to the love of my life and enjoyed the day and really just let tomorrow be tomorrow.
Getting married was the easiest decision I ever had to make, and that was because I love Katie. It was the best day of my life, and it was then subsequently followed by one of the scariest times in my life.
That's because a day later, Katie was in the hospital for chemotherapy.
She had the chemotherapy first because I was a little bit concerned that her tumor was tethered to the chest wall, and I wanted to be able to shrink that tumor down a little bit so that we wouldn't have to take a lot of muscle on her.
Katie started an aggressive course of chemotherapy. She received 8 treatments.
Almost immediately afterwards, there's definitely a sense of fatigue.
It's hard to see someone you love start to get that run down, but it progressively gets worse. Chemo is toxic, but it treats the cancer.
The hair loss was also another biggie. That didn't start happening until October, but when it did, it happened in the space of 3 days. And I went from having a head full of hair to being bald as a bowling ball.
She was just as beautiful without hair as she was with it. She never believes me when I tell her that, but she was.
Chemotherapy lasted 4 months. It ended 2 days after Christmas.
That was truly a great Christmas present, to be able to go in, know that after that I was done, to ring that bell, the I'm done with chemo bell.
We measured the tumor during each treatment, and her tumor shrank with the chemotherapy. And we hoped that also what it was doing was preventing a recurrence of any of those cancer cells somewhere else in her body.
Surgery was next.
I was scared. I was very scared, and I was very sad as well.
Despite Katie's fears, she kept looking ahead. Thoughts about the future got her through this very difficult time.
Knowing that I would be cancer-free on the other side. Knowing that this was my best option to continue on and live the life that I wanted to live. To be healthy, to have kids, to not have to worry about this anymore.
Surgery is just plain scary. At the end of the day, your loved one is wheeled off down a hallway and the doors closed behind, and then you go wait in a room. 9 hours later, Dr. Cass came downstairs and told us that everything went well.
Her nodes were negative, and the tumor, there was a little bit of residual tumor, but all her margins were clear. And we were able to perform what we call a total skin-sparing mastectomy. So it really tries to preserve the natural envelope of the breast tissue to give you the best cosmetic result.
Recovery took some time, but she got some encouraging words from her Grandma B, who has survived 2 bouts of breast cancer.
She said to me, "Honey, you'll get through this. As long as you stay positive, you'll get through this and you'll be just fine." And it turns out she was right.
As Jake and Katie celebrate 2 years, happiness is now at the center of their lives.
It was great to see her get through it. She came through it like a champ. She fought the entire way.
I feel wonderful now. I feel absolutely wonderful now. Lucky enough to have a clean bill of health and have my energy and my hair and all of it.
Katie and Jake can't thank their families enough for all of the love and support they gave them. Back to you, Alicia.
Deborah, you did a great job. Thank you so much. And Dr. Rina Cass joins us now. She's co-director of the Hershey Breast Center. So Katie had a double mastectomy. I think women are always hungry to hear about advances. How has that surgery evolved?
Well, it's evolved a lot over the past several years. You know, if you think about what we performed decades ago, where women would have these radical mastectomies, it was so disfiguring. The muscle would go, all the skin would go, and now we're able to perform these wonderful, beautiful skin-sparing mastectomies, where, you know, most, if not all, of the natural skin is preserved. And this is wonderful for women that have a genetic predisposition to breast cancer, where we can cut their risk of cancer by 93%.
Now, of course, women, what we're really all hoping for is a cure. But until we get there, what other advances can you tell women about?
Well, this past year, there's been a lot of dramatic changes that have happened underneath the arm. It used to be that for women, if you had any nodal spread from the cancer in the breast to the nodes, you'd have to take out the majority of the nodes, and that winds up with a lot of morbidity. But there was a trial that was published this past year called the Z11, and in that trial for women that were having a lumpectomy with radiation, if they only had a few nodes positive, we found out that they didn't really benefit from having additional nodes taken out. They didn't have any worse survival, and there was no increase in recurrence. And so, you know, we've been able to limit the amount of morbidity for a lot of women.
One thing I always think about, and you well know this, I mean, when a woman gets diagnosed, so overwhelming just to hear the news, but then she has a million decisions to make. I mean, are there some words of wisdom you can give to women to help them make these big decisions?
It's tough. The first thing I would say is know your options. And you know, if you don't hear all the options of breast conserving therapy and a mastectomy, ask questions. There's no silly questions. Know who your team is. You know who your doctors are. There are websites, U.S. News and World Report. Find out about the hospital you're going to. And lastly, we understand that it's difficult to make a decision. And so at Penn State right now, we're working on a tool in collaboration with Harvard and MD Anderson to help patients make a good decision, to educate them on the options, and to find out, incorporating their own values, what's good for me.
Perfect. Okay. Dr. Cass, thank you so much.
It was great to be
job.
here. Yeah.
All right, let's check in with Deborah again. Deborah.
Thanks, Alicia. The phone lines are busy. The number to call is 717-346-3333. Here to answer our viewer questions this evening is the nurse navigator at the Breast Center, Michelle Farnan. Thanks for being with us.
Thank you, Deborah.
Here's our first question. My grandmother and my mother both had a double mastectomy. What are the chances I will need the same?
A woman's risk of breast cancer is really determined by her personal health history as well as her family history. And there's only about a 10% true genetic link to the disease. So it's really important to think about, why did your mom and grandmother have that surgery? Did they have a BRCA genetic testing done? And all of the things that go into your own personal risk. So I encourage you to talk to your healthcare provider and perhaps be considered for some additional screening methods or perhaps preventive measures.
Okay, thank you.